Ever pondered on the silent whispers your body tries to send you? Especially from one of the most tireless workers within you, your liver. A true superhero, working relentlessly, clocking in over 500 tasks, including the critical ones like filtering out toxins and processing nutrients. But what happens when our body's superhero starts to falter? Imagine the liver as a mighty superhero, garbed in crimson, tirelessly working behind the scenes to keep the city, which is your body, functioning smoothly. This vigilant protector operates silently, often suffering in silence, for it possesses the exceptional ability to repair itself. But as with any great hero, there are times when it needs assistance. When your liver starts to struggle, it sends out subtle distress signals. These peculiar signs might not be immediately associated with liver issues, but they are indeed the liver's silent SOS. It's a silent sufferer, dealing with damage for years before you might even realize something's amiss. Whether you're already experiencing these signs or just want to stay informed, it's time to unravel the enigma of liver damage. Let's delve deeper into understanding what these signals mean for the well-being of your body's superhero. The liver is a vital organ, performing numerous essential functions from filtering toxins, producing bile, regulating blood sugar, to synthesizing proteins. However, this superhero can also be vulnerable to various villains, such as infections, alcohol abuse, obesity, and genetic diseases. If these villains prevail, the liver might suffer serious damage, leading to complications like cirrhosis, which is the scarring of the liver due to long-term damage. This scar tissue hampers the liver's functioning, marking the end stage of liver disease. So, how do you know if your liver is in trouble? The common symptoms of liver disease include jaundice, abdominal pain and swelling, nausea, vomiting, and loss of appetite. However, there are also some less obvious signals that may indicate liver damage. In summary, being in tune with your body's silent superhero and understanding its distress signals can be a critical step towards maintaining your health. Remember, your liver is a tireless worker, a superhero in its own right, playing an incredible role in keeping you healthy. So pay attention to the subtle signs and don't let your superhero suffer in silence. Before we dive into some of the subtle signs that may indicate that your superhero may be suffering in silence, don't forget to hit the like button. It's a small action from you, but it helps us to reach more people who need this information. Share this video with your friends, family, and anyone you think could benefit from understanding the silent whispers of their body's superhero, the liver. Don't forget to subscribe to our channel for more insightful videos. Click the notification bell so you never miss an update. Your body's superhero is counting on you to stay informed. Remember, the health of your liver is in your hands. Now that you've subscribed and hit the notification bell, let's dive into the next chapter. Before we move on to the other superheroes in our body, let's take a moment to discuss a subtle sign of liver disease that often goes unnoticed: itchy skin. If you've been experiencing persistent itchiness all over your body, it might be more than just dry skin or an allergic reaction. It could be your liver sending out an SOS. When your liver is functioning properly, it filters out toxins from your blood. These toxins are harmful substances that can cause irritation or damage to your body. However, when your liver is damaged, it cannot perform this crucial task effectively. As a result, these toxins accumulate in your blood, causing irritation to the nerves under your skin. This can result in an uncomfortable, persistent itchiness all over your body. It's important to note that itchy skin can also be a symptom of other conditions that affect the skin, such as allergies or infections. However, if you're experiencing persistent or severe itchiness, especially if it's accompanied by other symptoms of liver trouble we've discussed in our previous scenes, it's crucial to consult your doctor for a proper diagnosis and treatment. Remember, your body's superhero, the liver, might be quietly signaling for help. And as we've learned, the health of your liver, your body's superhero, is in your hands. So pay attention to these subtle signs and take action when necessary. Stay tuned as we continue our journey to discover more about some other signs. As we progress in our discussion about the subtle signs of liver disease, we shed light today on one of these indicators that is frequently overlooked: dark or brown urine. Our urine is typically a pale yellow or clear, a characteristic credited to the bile produced by the liver. When there is a compromise in the liver's health, this alters its bile production. This disruption can lead to a darkening of the urine, appearing brown due to a deficiency in the standard bile pigment. Bile is instrumental in more than just liver detoxification. It also aids in fat digestion, which contributes to the normal color of urine. However, let's not forget that darker urine is not solely indicative of liver disease. It can also be symptomatic of other health issues like dehydration, kidney disorders, or urinary tract infections. In addition, certain medications and some foods like beetroot, blackberries and fava beans can cause urine to darken. Even mild dehydration can lead to noticeably darker urine. Therefore, it's crucial to stay hydrated and monitor any changes in the color of your urine. If the color remains dark for an extended period, it's important to not overlook this condition. Always consult your doctor for a comprehensive diagnosis and appropriate treatment if you observe such variations. In conclusion, your body's superhero, the liver, might be subtly signaling for help. Be vigilant for these understated signs and take timely action when deemed necessary. In the universe of physiological superheroes, the liver, our often overlooked champion, frequently communicates in hushed undertones. Spider angiomas, characterized as small red or purple spider-like blood vessels that can manifest on the skin, often serve as a subtle sign. The proliferation of these vessels is largely driven by increased levels of estrogen in the bloodstream, but they may also result from other hormonal conditions. Mentioning that while spider angiomas can emerge anywhere on the body, they predominantly appear on the face, chest, or arms. They may look like a central red spot with thin branches radiating from it like a spider web. And they may also turn white when you press on them when combined with other symptoms of liver damage. Their signal is a clear red flag for liver disease. Being vigilant and attentive to these quiet signals could mean the difference between health and sickness. As mentioned before, when our body's superhero, the liver, is in distress, it sends out signals. One of the most common and easily noticeable among these is a strong, musty odor emanating from your breath or body. This unpleasant whiff is far more than just an alarm bell for severe liver disease. This smell results from an increase in sulfur substances in the bloodstream, which is a direct consequence of the liver's inability to filter toxins. When the liver, which is normally a proficient detoxifier, gets overwhelmed, this is one of the results, which is a buildup of these harmful substances. As these toxins increase, they exit the body through sweat, giving off a distinct odor. However, it's essential to understand that a foul breath or body odor may not always herald a problem with the liver. Other possible culprits could include gum disease, acid reflux, and constipation. Gum disease can cause bad breath due to the presence of harmful bacteria. Acid reflux, on the other hand, brings up stomach acids that can result in an unpleasant smell. Constipation, too, can cause bad breath as toxins builds up in the body. Recognizing these signs and their potential causes is crucial. It's not about jumping to immediate conclusions, but about being aware and taking action if these symptoms persist. Doing so will ensure the body's superhero, the liver, gets the help it needs when it needs it to continue maintaining its efficient functioning and our overall health. As we continue unraveling the subtle signs of liver trouble, we encounter a symptom that might seem unrelated at first glance: pale or clay-colored stools. Under normal circumstances, our stools get their characteristic brown color from a substance called bile. Produced by our body's superhero, the liver, bile plays a crucial role in digestion and elimination of waste. When the liver is damaged, it may struggle to produce enough bile, resulting in unusually light-colored stools. This change in stool color is often overlooked, but it could be a telltale sign of a struggling liver. Just like the unpleasant whiff we discussed earlier, pale stools are not a definite indication of liver disease, as they can also occur due to problems in other parts of the digestive system. However, if you notice a persistent change in the color of your stools, especially if accompanied by other symptoms, it's essential to consult a doctor for proper diagnosis and treatment. Remember, these superheroes don't wear capes, they don't make grand entrances, but they are always there, working tirelessly to keep us healthy. Awareness of these subtle signs is our first step towards ensuring their well-being, and in turn, our superheroes will perform excellently. Stay tuned as we continue to delve deeper into the fascinating world of our body's superheroes. As we journey together through this fascinating exploration, it's essential to remember that our body's superheroes don't just exist within us. They rely on us. They count on us to be vigilant, to recognize their silent whispers, and to take action when they're in need. That's right, your body's superheroes are counting on you. So, now that you've subscribed and hit the notification bell, let's dive into the next chapter. Our bodies are full of superheroes, not just the liver. Each superhero has its unique way of protecting us, maintaining balance and ensuring our well-being. From the heart, the kidney, the brain to the lungs and more, our body is a marvel of interconnected superheroes, each with their own unique whispers and signs of trouble. In the upcoming videos, we will unravel the mysteries of these other superheroes, revealing their unique roles, their subtle signs of distress, and how we can ensure their well-being. The journey to understanding our body's superheroes is a journey of self-care and self-awareness, and we are glad you are here joining us on this adventure. Remember, it's not just about recognizing the signs, it's about taking action. And action starts with knowledge, so stay tuned, keep learning, and let's ensure that our body's superheroes can continue their tireless work, keeping us healthy and strong. We're nearing the end of our superhero adventure, but before we wrap up, we want to hear from you. Don't be shy. Drop a comment below to share your thoughts. We're always eager to learn from our viewers and their experiences. Also, share this video with your loved ones. Trust us, they'll thank you for this. If you found this video helpful, click on the thumbs up button. And if you haven't already, hit the subscribe button and the notification bell. This way, you'll be the first to know when we upload more videos on nutrition tips, healthy recipes, a healthy lifestyle, and more. Remember, staying informed is the first step towards staying healthy and happy. Before we sign off, we'd like to remind you that the information provided in this video is for educational and informational purposes only. It is not intended as a substitute for professional medical advice, diagnosis, or treatment. Everyone's dietary needs and health conditions are unique. And before making significant changes to your diet or lifestyle based on what you've learned today, we strongly advise consulting with a healthcare professional or registered dietitian, especially if you have underlying health conditions. Your health is your greatest asset, and it's crucial to make informed decisions with the guidance of professionals. The journey to health is not one size fits all, and what works for one person may not work for another. So take this information as a starting point, and work with your healthcare provider to make the best decisions for your health. Until our next video, stay healthy, stay happy, and keep learning.